Good morning, everyone, and welcome to the release of the 2020 Kids Count Report, and which includes our county profiles. I'm Cecilia Zalkin, President of Advocates for Children of New Jersey, and in a few minutes, I will be joined by Alana Vega, who is ACNJ's Kids Count Coordinator, who will take you through the data more specifically. So, like so much else this year, this is really an unusual time to release our Kids Count data. While the data is up to date, as you will see, the most recent data that we have, it is still data that is almost exclusively pre-pandemic, which raises the question about how relevant it is in the context of what's going on in our state and in our country right now. Is there any data about what's happening right now? And what does the future look like? How do we begin planning? Since the current data is somewhat incomplete, how do we begin planning for the future when we begin to come out of the pandemic? That's why this year's Kids Count is a little different than Kids Counts that we've released in prior years. In addition to our annual county by county data, we have paired the report this year with the release of a new report from the Annie Casey Foundation, which is also out today, looking at the pulse data, which is done by the Census Bureau, and is a survey of how families are faring. It is not a comprehensive data set, but it gives us an immediate picture of what the current issues are, what's going on across the country. And this report also looks by state to give us a sense, some signals about what lies ahead. So to me, the themes of this year's report linked with the Casey report is something along the lines of yesterday, today, and tomorrow. The report certainly shows us where we've been, where we were before, and it also, the Pulse report put out by Casey, shows us a bit about where we are now and what families are beginning to experience. And I think that put together sends some ideas, some signals to us of what we need to be thinking about in the future. So as you'll hear from Alana in a few minutes, when we look at the ACNJ Kids Count data, which is primarily from 2018, the data does show that we made steady progress across the state, as a state, but also in our counties, especially in areas related to income. We saw child poverty decrease, we saw family income increase, unemployment decrease, all positive signs. And we also saw an increase in the availability of childcare, which is incredibly relevant in light of the impact of the pandemic. And we'll talk about that in a few minutes. I think it shows as a state we're moving forward in a very positive way. But again, this was pre-pandemic. Today, the Pulse survey shows that things are beginning to slow and that there are some alarming signals ahead, primarily in areas related to basic needs. Families are struggling. And I think the Pulse data looks at some of those key areas that give us the first indication of the impact of the pandemic on children and families. And I think the other thing that the Pulse data does is it highlights the continued inequity by race in our state. Alana will explain when she does her presentation that not only are our county by county profiles available today, but we have a data dashboard on our website, as well as an increased data broken down by race. And it paints, I think, a story that we're aware of, but it is more alarming now in light of everything that's happened this year. Our state, like our country, still has issues with racism and the disproportionate representation of families of color in some of the data that we are presenting today. So I think when we look ahead, when we take this data and look ahead, we certainly have a concern about what appears to be a deepening divide across racial lines, across income lines. Too soon to tell the long-term impact, but the signs are not good. And again, you'll see in the Casey report that Alana will talk about that families are struggling in the most basic issues of health, housing, food insecurity, and mental health issues. So why is it important to put this data out today? Well, I think it is very important, and it addresses some immediate and long-term needs. It is not too soon to begin planning. We can anticipate, We know the struggles that families are facing. We need to start planning now. How do we direct services? How do we direct our resources to help families where it is needed the most? And also looking toward long-term planning. These are interconnected issues of equity, race, income. We need to start looking at that, and how do we address that in the days ahead? Equity, as you'll see, has always been an issue, but I think in light of the impact of the pandemic, it is worse. Kids Count provides a baseline by which we can measure both our progress and our needs. And again, it will help in planning. But for an agency like ACNJ, it also helps with our advocacy. And we know we have many partners who use this data not only to plan, but also to advocate. And I think this is critical. And this year, more than any other year, our advocacy needs to be not just on the state level, but on the federal level. If you look back over the last 10 months of the pandemic, it was the federal stimulus package that helped our state and our families survive. And this data, I think, in our first effort at advocacy, is very relevant to our advocacy on the federal level. So I think there's a lot in this today. It's not going to all come out in the presentation. I urge you to look at our website to check out our data dashboard. We are happy to answer any questions, not only during this presentation, but afterwards. Part of advocacy is providing information. And we believe that this is information that people can begin to use to plan, to advocate, and to understand the issues that are confronting our children and families today. So let me turn the presentation over to Alana Vega, who is ACNJ's Kids Count Coordinator, who is going to start the presentation of the data. Again, thank you for joining us today. And I'd be happy as questions come up to stay on and answer any questions that you might have. Thank you.
All right, thank you, CL, and good morning, everyone. My name is Alana Vega, and I am the Kids Count Coordinator at Advocates for Children of New Jersey, and we're really excited to have you all here today with us. Now, just bear with me as I get my screen set up. All right, so good morning. We're really excited to be able to share some of our Kids Count data with you guys this morning, and we're excited to be doing this for the first time on a virtual platform. But before we get started, I did want to pose a question to everyone. So you'll see a poll. It's asking, where are you from? Northern, Central, or Southern New Jersey? Or if you're from out of the state, please take the time to respond now. If you've been to a Kids Count forum in the past, these are typically regional, and we're able to actually ask, which county are you from? And I get a show of hands. Unfortunately, we can't put all 21 counties in a Zoom poll, so we have to resort to regional responses. But while you all are completing that poll, I did want to go over some housekeeping items. First, this webinar is being recorded, and we will make the recording available after the end of this webinar, along with a copy of this slide deck. We have been sharing links to the report and all of our data products, so please check those out. And during the presentation, if you have a question, please use the Q&A function. We ask that you not submit questions to the chat. It's just much easier for us to keep track of any questions if they come in through the Q&A option. And then at the end of the presentation, I'll take some time to answer those questions that have come out throughout the presentation. So we have the results from our poll, and you can see here it's actually a pretty even split. So we have 30% from Northern New Jersey, 31% from Central, and 35% from Southern New Jersey. So the biggest showing from Southern NJ, although we do have some folks from out of state, which is great. So thank you all for participating in the poll. So now that we have gotten some of our housekeeping out of the way, I'd like to first introduce who we are. I'm sure many of you are familiar with ACNJ, but for those who may not be as familiar, we're a statewide independent nonprofit organization that has been in the business for more than 40 years. And we work to inform legislators and policymakers on issues relevant to children in our state. And our end goal is to elevate the voices of children is so that every child grows up healthy, safe, and educated. And one of the ways that we elevate kids' voices is through our Kids Count work. Kids Count is a national initiative funded by the Annie E. Casey Foundation, and there's a Kids Count grantee in each of the 50 states, and ACNJ is the New Jersey grantee. And one of the goals of Kids Count is to use data to track the well-being of children. Over the years, we at ACNJ have produced several different Kids Count reports on state and county data. We've also released some municipal level reports. We do an annual North Kids Count report, and in the past, we've also done reports on Patterson and Trenton. So today, I'm going to be going over some of the data from our annual Kids Count County Pocket Guide, but also some of the data from our somewhat new, our second iteration of our county dashboard, our Kids Count dashboard, that is an interactive database. So before I get into some of the Kids Count data that we have collected, I want to take some time to talk about a resource that's available to everyone, which is the Kids Count Data Center. So the Annie E. Casey Foundation, which funds the Kids Count initiative, maintains this site. But we also upload our own Kids Count data for our counties and for our state, and as well as some indicators for the city of Newark onto the Kids Count Data Center. In addition to that, National Kids Count also produces some state figures. So you're able to compare state to state, and you can customize different visualizations. It's a really great tool, and I encourage folks to utilize it. Now, stemming off of that discussion, today the Annie E. Casey Foundation actually released a report focusing on areas of concern for families across the country. And this was entitled Kids, Families, and COVID-19 Pandemic Pain Points and the Urgent Need to Respond. And this report really relies heavily on data made available through the Census Bureau's Household Pulse Survey. So earlier this year, the Census Bureau rolled out this experimental survey known as the Household Pulse Survey, and it was designed to be deployed quickly so that we could get a sense of how people throughout the US were coping with COVID-19. And it asks questions on a variety of different topics, ranging from economics to healthcare, to mental health status, to housing. There's a lot of different factors, and education. Now, like I said, this survey was designed to be deployed quickly, and it was collected over several phases. So the first phase started in the spring, and the results were released every week. And then in the second phase, which started later this year, the results were released every 2 weeks. So currently, the Bureau is actually in the process of collecting data for a third wave of this study. But again, this was to provide snapshots of how households were doing during the pandemic. One thing I do want to alert folks to is this is a very unique survey, and it's important to keep in mind that we should avoid comparisons with other surveys. Again, this was deployed quickly to assess the public health crisis, and most importantly, it was deployed online only. If any of you are familiar with Census Bureau surveys, many of us participated in the decennial census this year. You know that there were multiple ways to collect responses from households, right? You could respond online, over the phone, via mail. That was not the case for this household pulse survey because of the rapid response nature. It was online only, which does have some limitations in terms of the data collected. And then the last caveat that I want to mention about this data product is that the household pulse survey does not collect data on children themselves. So this was a survey that was administered to adults ages 18 and older, but respondents were asked if children were present in their household. So we are able to look at data for households with children, but not necessarily children themselves. So just an important point I'd like to distinguish. So here we have some data that was collected in the Household Pulse Survey and is available on the Kids Count Data Center. As I mentioned, the time periods associated with these data points correspond to specific weeks of collection, and National Kids Count actually pooled data collection figures for weeks to kind of improve the estimates. So this is for the period of September 16th through October 12th of this year. And you can see that statewide here in red on this bar graph, roughly half of households with children indicated that they suffered some loss of employment income since the start of the pandemic. And that's incredibly high when we think about that. But while that's the average for households with children, you see here that we've broken out the data by race. Now, we're only showing a specific time period of data collection, but we did see that when we looked over several weeks of data collection that are available on the data center, Black and Latino households reported income losses at higher percentages than the state average. And if you've been listening to the news, you know that we've been hearing about the really devastating health impacts of COVID-19 on people of color across the country. And I think it's also really important to link that to the impacts this is having on families' economic status, right? This is something that households of color are really dealing with at disproportionate rates than other groups. Now, related to the figures I showed on the previous slide, we also have some data on that's quite concerning about trends regarding families' difficulty affording basic needs. So on the left, data are showing that 19% of households with children expressed little or no confidence in their ability to make their housing payment on time. That includes a rental payment or a mortgage payment. And then for that same time period, more than a third of families with households with children, indicated that they were having difficulties paying for usual expenses. So what's a usual expense? This includes but isn't limited to car payments, housing, food, healthcare, etc. So this 36% does overlap with the 19% figure because they both include housing as a cost. But I think we begin to see a picture emerge when we look at these two especially when we look at the last slide, right? Many families have lost income since the start of the pandemic. And while there has been some support for families who are out of work or individuals out of work, we're still seeing a number of households, even into the fall, who are having difficulty paying for their needs. So within the Annie Casey report, there were 4 areas of concern that were identified in their report. They really focus on these 4 data points, but there is more data available on the data center, which we'll talk about on the next slide. So the first area that they looked at was food security. The data are showing that 9% of New Jersey's households with children reported sometimes or often not having enough to eat over the past week. The second pain point was housing stability, which I covered in the previous slide, right? 19% of adults living in households with children had little to no confidence in their ability to make their next housing payment. The third was affordable healthcare, which showed that 10% of adults in households with children indicated that they did not have health insurance. Again, we typically report on the percentage of children without health insurance in our American Community Survey data. They're not comparable, and this is also kind of a tricky indicator because it's specific to the adults living in households with children. And the final point was mental health. So the data showed that 14% of New Jersey's adults with children reported feeling down, depressed, or hopeless. And while this is specific to adults, I think it's really important to make a connection to the impact that this has on children. We know that especially for very young children, the mental health of a parent impacts the relationship that they have with their child. And this is really crucial for healthy social emotional development. So this is a data point that really stood out to me when I was looking over the report. So to go back to the Kids Count Data Center for a second, because I've been saying that you're able to navigate for more data. If you go to the data center, you'll actually see a map when you first sign into the website. So you'll want to select New Jersey from the map, and it will take you to this page. So once you have made sure that you've selected New Jersey, you want to then check this box on the left-hand toolbar that says special topics, and you'll click COVID-19. And then from there, you'll be able to see all the different indicators that are available for the household pulse survey. The data are organized into different topics, and there's also data available by race and ethnicity, as well as for adults ages 18 to 24, which was a sort of special age group that the Casey Foundation chose to focus on. So once you've done all that, congratulations, you have successfully navigated the Kids Count Data Center. There's a lot of information here. And again, just keep in mind that this is an experimental data product. it is very unique, but it is some of the best data we have to get a sense of how families are doing right now. So with that, I'd like to now transition to some of the data from our Kids Count Pocket Guide and also our dashboard. But before we get into that, I want to remind folks where the data come from that we focus on. You'll hear me say our data, but I do want to say it's not actually our data. These are publicly available data sources. The benefit of Kids Count is that we put all of these different data points into one easy to access, easy to read place. But we do obtain our data from a number of different federal and state sources. And then for some of our city level reports, we do work with local school department, our school districts and police departments to obtain some data. So let's move into some demographic information, sort of put some context on things. So here we have our basic population data for children under the age of 18 in each of our 21 counties and then for the state overall. So I wanted folks to note that children comprise roughly 20% of our state's total population, and this holds true for most counties. Some are a little over, some are a little under that, but for the most part, that's where most stand. Now, not on this slide, but something I do want to note is that most areas saw declines in their child populations between 2015 and 2019. And the exceptions to this were Ocean County, which saw a 6% increase, and then Essex County, which saw an incredibly small increase, less than 0.04 of a percentage point, but an increase nonetheless. So that's sort of our starting demographic data. But something else that stood out in the data that I wanted to take some time to discuss was a comparison of the demographics of children from the years 2000 to 2019. So not quite a full 20-year spread, but close. So I wanted to give you an idea of some of the shifts that are happening. We're seeing a shift in the makeup of New Jersey's child population. So you'll notice that the population of both non-Hispanic Asian children as well as Hispanic or Latino children has increased since the year 2000. So in 2000, 6% of New Jersey's child population were Asian children. It has now increased to 10%, and for Latino children, 16% to 28%. Conversely, the population of white children has really declined over the years, going from 60% to 46% in 2019. So this is just a trend that we've been noticing that I wanted to take some time to explain. And another important demographic indicator here, we have births to foreign-born mothers. And the reason we include these data is because National Kids Count defines an immigrant family as one in which at least one parent, was born in another country. And these data allow us to see the trend at the county level. Sometimes looking at census data for smaller populations can be kind of tricky, and we are able to look at birth records thanks to New Jersey Department of Health and their interactive database to pull this information from there. So overall, you see that 40% of New Jersey's births were to foreign-born mothers, and really showing that New Jersey has been and continues to be a hub for immigration in this country. And some counties, the percentage is actually higher, 50% or more. So more than half of births occur to individuals born in another country. And so those counties are Hudson, Middlesex, Passaic, and Union. And I think that that makes sense when we think of sort of the thriving immigrant centers of our state. They're located in those counties. So not surprising data, although when we first started reporting on this, I think folks always knew how important immigrants were to our state, but this really shows how important they are. So that was some of the basic background on demographics. And before I move into some of the trends, I want to give a bit of a disclaimer. Seal had mentioned this in her welcoming remarks. We know that COVID-19 has upended so many things over the last year, and it's also revealed some limitations of data. The primary being that much of the data we collect are old. Economic, health, education data in this year's Pocket Guide, as well as what's on our dashboard, are all mostly pre-pandemic. And this is because most official sources of data take time to collect. They have to collect them, then verify, assess them. That all takes time. But the data in this report will serve as a benchmark to evaluate the effects of the pandemic moving forward. That being said, I do want to flag some indicators that we have traditionally looked at for our Kids Count publications, things like chronic absenteeism, school meal data. It's really unclear if data collected during the pandemic can be compared to those previous figures. When students are learning virtually, can we compare attendance to a virtual session in the same way that we would in-person education? I'm not saying there's a right or wrong way, but it's something that we need to think about as we look at the data and we look at trends moving forward. Now, that being said, there are still some indicators that can really give us a glimpse into how families are doing, or at least indicators that are signaling we need to continue monitoring them throughout the pandemic. So the first being rent burdens. We know that housing costs comprise the biggest shares of most New Jersey's families' budgets. This was something that was a concern pre-pandemic, and it will likely continue to be a concern. Here you can see the comparison of percentages of households spending too much on rent between 2015 and 2019. What is too much? The rule of thumb is more than 30% of household income. So you can see here that in 2019, close to half of New Jersey's households spent 30% or more of their income on rent. And this was pre-pandemic, right? When we were seeing historically low unemployment rates. We had seen child poverty rates on the decline over this time period, but we were still seeing that this was an incredibly, this comprised a huge part of most of New Jersey's budgets. So based on these numbers, we can start to infer that that come January, many families could be in a precarious position as the protective housing measures begin to come to an end. So just something to flag. Now, if you've attended a Kids Count presentation in the past, you've probably heard me discuss the decline in the number of children receiving TANF over the years. And the trend for 2016 to 2020 does indeed show a 39% decline statewide. But if we look at the 2019 numbers and compare them to 2020, we do see a slight increase in the number of children. It's about 3,000 more children receiving TANF between June of 2019 and June of 2020. And this is something that we will continue to monitor, but it does seem to reflect the impact the economic downturn is having on families with children. And a similar trend occurred with SNAP benefits. So the 5-year trend data are showing a decline of 20% statewide, but the 1-year trend shows an increase of about 8,500 kids, or a 3% increase. Again, this is something to keep an eye on. I do want to flag that if we looked at the data between March of 2020 to the summer of 2020, we would see more nuance in that increase. But looking at the year trends, this is how it shakes out. So those were some of the data that can help frame some of the impacts of the pandemic, but there were a few other noteworthy trends that I want to take some time to talk about. So here we have a substantial decline in the number of youth with a substantiated or established case of abuse or neglect between the years of 2014 and 2019. Now, typically my comparison years for a Kids Count report are 5 years worth of data, so that would be 2015 to 2019. But I started with 2014 because that was the first year that we had full implementation of DCF's new 4-tier system. And so it shows you the full range of comparison. The 4-tier system was introduced actually in 2013, but it includes several different abuse rulings: substantiated, established, not established, and unfounded. So one of the reasons for this decline might be the transition to the new 4-tier system, which allowed caseworkers to make more nuanced assessments based on the needs of families. They could now take some mitigating circumstances into their decision making. And so that might be what we're seeing shake out in the data over this time. But for those who don't know, you can look at more of these data on our dashboard, but also DCF and Rutgers have this really wonderful portal online, the Child Welfare Portal and Hub. It's a great tool. I encourage folks to use it, and the link is at the bottom of this slide. And we will be sharing these slides, so you'll have the link at your disposal. So now switching gears entirely, we also saw some really steep increases in preschool enrollment, and that's thanks to preschool expansion dollars made available across the state. So on this slide, I've only highlighted the counties that saw a 20% increase or more between the 2015-16 school year and the 2019-2020 school year. I want to note that Hunterdon County is on this slide, but it's kind of a technicality. They did experience a 38% increase in preschool enrollment, but their enrollment was very small to begin with. So that does distort the figure a bit. But we saw counties like Morris and Ocean more than double their preschool enrollment numbers, which is really astounding. And not on this slide, but I believe Sussex County completely increased their preschool enrollment. They were formerly at 0, and now they have a few hundred preschool enrollees. So a really interesting trend. And like I said, Morris and Ocean really saw huge increases in their enrollment. So now I wanted to transition into some of the data that we disaggregated by race. Beginning last year, we started doing this on our data dashboard. And this year we have a fact sheet on our webpage that has some of the data disaggregated by race by county. But for the purposes of easy viewing, I'm going to show you some statewide figures. So here we have some disparities in low birth weights. Now, ACNJ is committed to working towards reducing racial disparities in infant and mental health through our work on the Pritzker Children's Initiative. And there's also work being done through the Office of the First Lady, Tammy Murphy, with her Nurture NJ, as well as Healthy Women, Healthy Families campaigns. And ACNJ is working in partnership with them as well. Here you can see that statewide, 7.9% of infants born in 2018 had low birth weights, meaning they weighed less than 2,500 grams. You'll also notice that for several racial groups, there was a higher percentage of low birth weight babies than the state average. For example, 13% of Black infants and 9.1% of Asian infants, as well as 8.8% of infants of some other race and 9.5% of those who identified as 2 or more races. And I want to be clear, when we say race, this is actually the race of the mother, not of the baby. Also to note, Native Hawaiian and Pacific Islander babies, infants also had high percentages of low birth weights, but they comprise a relatively smaller share of births statewide. There are about 55 total births to this group in 2018. We also saw similar trends when we looked at the percentages of mothers who began their prenatal care in their first trimester. So you'll see here, statewide, 73.2% of women began prenatal care in their first trimester. Black and Latina mothers were less likely than the state average to begin receiving prenatal care in that first trimester. But I want to take some time to slice the data another way. Now, this isn't in our reports, but I wanted to provide this context for everyone. And there are fewer racial categories here for the purposes of viewing. But when we look at data by education and race, we see some other trends emerge. There are disparities in prenatal care onset among women with less than a high school education, as well as among women with college degrees, right? We see here that in particular, Black women with less than a high school diploma are less likely than other groups to start prenatal care in their first trimester. But we also see that same trend amongst women with a college degree. And I show this to get folks thinking about what might be the drivers of these trends, right? If we look at education levels as a proxy for income, we can see that prenatal care onset is lower among Black and also Latino women across incomes. And I think this challenges some of the assumptions we might have about what are the barriers to services. It may not just be income-based. There are other sort of structural prejudices and barriers that women of color experience when interacting with the medical field. So something to continue to think about. And I think in popular culture, we've been hearing more and more about the experiences of particularly Black women who are pregnant and navigating these systems. Another area where we see disparities is in the demographics of out-of-home placements in child protection and permanency out-of-home placements. So here we see that children who are Black or African American comprise 42% of the total foster care population. And again, it's not a perfect comparison because CP&P placements do include youth over the age of 18. But when we compare that figure to our statewide population data, we know that Black and African American youth are less than 15% of our statewide population. And so this overrepresentation is something that folks are aware of. And the overrepresentation of children of color is something that DCF, in partnership with the New Jersey Judiciary and other members of the New Jersey Children in Court Improvement Committee, are collaborating to address some of the root causes for this disparity in foster care placements. Another indicator that we have highlighted over the years is county detentions, or admissions to county detention. And New Jersey really has seen dramatic declines in the number of youth admitted to county detention centers over the years. Between 2014 and 2018, the state saw a 29% decline in admissions, yet we still see racial disparities persist in who is admitted to a detention. So of roughly 2,200 admissions statewide in 2019, 62% of youth admitted were Black youth. And again, going back to our population data, Black youth under age 18 comprise fewer than 15% of the state's total child population. It's not a perfect comparison because we know admissions to detention tend to be concentrated among older youth. But even when we look at the population data for youth 12 to 17, we see that Black youth comprise 13% of that total age group's statewide population. So again, a very clear disparity here when we look at these data. So that concludes most of the data presentation that I have today. If you're looking for more information, for more household pulse survey data, you can visit the data center as I had demoed earlier in this presentation, but you can also go to the Census Bureau's website and look at their interactive tool that they have for their household pulse survey. But if you're looking for more of ACNJ's data, please go to our website. I know we've been sharing the links in the chat throughout this presentation. There's a ton of resources there. You can also take a look at some of our municipal level reports. And I encourage you all to explore those resources. So that concludes my data presentation. But if you have questions, I'm happy to turn it over to that portion. If a question should strike you later in this week, please send me an email, avega@acnj.org. Happy to help, or happy to connect you to data resources that I know of to the best of my ability. So thank you all, and looking forward to some questions.
All right, Alana, thank you so much for that great presentation. For those that don't know, I'm Catherine Falegi. Usually I'm on the opposite side of the Zoom end, so now I get to show my face to all of you. So thank you very much for attending. We are welcoming for Q&A. Please make sure to use the Q&A function at the bottom of your screen. That'll allow you to ask questions. We'll be fielding those throughout the rest of the time together, as well as feel free to visit acnj.org, where we do have the presentations, where we do have the information available. So let's get started. I do see one question asking, given high median income, New Jersey's high median income, why are so many New Jersey's children still in low income housing or poverty?
That's a tough one. I think one thing that we always see when we look at our statewide income data and just our statewide data in general, you know, the Annie Casey Foundation ranks states annually on sort of different child well-being indicators. And New Jersey tends to perform at the top. We tend to be in the top 5 of states nationwide. But when we look at smaller geographies within our state, we see that while we are a relatively high income state, the disparities between the highest income earners and the lowest income earners are really expansive in New Jersey. And I think that's where we start to see those nuances. Yes, the statewide median income is much higher than perhaps neighboring states, but that isn't true across the board for households. And we even see that shake out with different counties. You know, some of our northern counties like Morris and Hunterdon have very high median incomes for households with children, but some of our southern counties have lower median incomes for households with children, right? Salem County, Cumberland County. And even when we drill down further into different municipalities, we see a lot of differences and nuances there. So that might be some of what's driving that trend.
Okay, thank you. And we do have another question. Is it possible to get the population data for children birth to 3 or birth to 5 years of age for each county?
So looking for total population data on our dashboard, we have data for children under the age of 5 by county. So that's vintage population estimates from the Census Bureau. And then on the KC Data Center, National Kids Count has statewide data by different age groups. And I believe theirs is also under age 5, or they label it as 0 to 4, but it's the same thing.
Okay. Now, did you see any data trends this time that happened to be eye-opening to you?
I think one of the things that was stark, and Seal had mentioned this, is the sort of clash with what is happening right now. We'd really been seeing child poverty rates decrease, unemployment rates decrease, and it was really striking to see that in the data, and then also hear the current events, right? Read the news and see what's happening in my own community and across the state. That was particularly striking. I think one of the things that really surprised me was actually the preschool enrollment data. I knew about preschool expansion. We knew that there was going to be more enrollment, but looking at how that actually took place across counties and seeing the increase for counties like Morris and Ocean, and thinking about what that means for those families and those children, COVID aside, is really incredible.
Okay, now let's see. So what is ACNJ's connection to the Pandemic Pain Points report? Is this a separate report from ACNJ, or are we simply reactive to the results?
So the Pain Points report is a separate report from ACNJ. This was produced by the Annie Casey Foundation. We are a Kids Count grantee, so there is New Jersey data in there. This was, again, pulled from the Household Poll Survey. So the data that I've highlighted in this report, in this presentation, some of it is from the actual Kids Count report, the Annie Casey's report, but some of it is also from the Annie Casey's work, Annie E. Casey Foundation's work that is presented on the data center. So it's a little confusing, but these are all data that we've been able to access because of the Kids Count network. This is not data that ACNJ pulled directly.
Okay, now this is regarding Black youth and foster care and detention. So the data for overrepresentation of Black youth, it remains consistent, pretty consistent over the years. So do we know why this is, and if there's anything being done to address it at the moment?
Yes, so I know that DCF is aware of the overrepresentation of youth of color, and it's something they're working to address with the New Jersey judiciary. And actually, our Vice President, Mary Coogan, is on. Mary is more involved in that work directly than I am. I am but the humble data collector. So Mary, if you could jump in.
Sure. So a couple of things. Judge Grant, who heads the system, as well as Commissioner Christine Norbert-Beyer, who is currently the Commissioner of the Department of Children and Families, are working collaboratively through the Children in Court Improvement Committee. Just this past summer and into the fall, all of the stakeholders had 4 days of training on race equity, bringing in some national people, and the counties have now been asked to fill out a data form looking at their race data and the overrepresentation of kids of color in foster care, and have actually been told to come up with some SMART goal, meaning to come up with a measurable goal of which to address it. Collectively on the state, the first thing that the department, that the Court Improvement Committee is looking at, along with it being one of the priorities of DCF, is to look at our policy and regulations around kinship care placements. It being thought that because of certain restrictions or licensing requirements, there are kids of color, primarily Black and African-American kids, who could be placed with kin if we could relax some of those restrictions. The department has done that, so I think that is moving forward. The department has also brought in a national expert, Carol Sprigner. She's from, I believe, University of Pennsylvania. And she's working with staff on the front end to really look at, do they have some biases when they come in and do their investigations? So again, it's been a long time in coming. It is not a perfect system, but I think people are actively addressing the issues and coming up with concrete plans. In the juvenile justice arena, there's a couple things. There is a statewide council that looks at juvenile cases, and through the Juvenile Detention Alternatives Initiative, which was sponsored by the Casey Foundation, they are been implementing a data-driven system to reduce the populations in detention centers. And in fact, over the past 10 or 12 years, New Jersey has closed 8 or 9 detention centers and significantly reduced our population. That has not really changed the overrepresentation of kids of color. So they are looking at the lower tiered systems. I know the Attorney General just came out with some more instruction about like curbside reprimands as opposed to kids getting charged. So they are actively looking at things to try and address that. The last thing I just want to mention is that there was a reform effort in 2015, which allowed youth who had been waived to the adult system to be brought back down to family court. And this has resulted in at least 45, maybe 60 youth who were in adult corrections to be brought back into the family court. The idea being they would get better services. And I think that also does impact then the makeup, the racial makeup of the kids in detention. But I think these are all positive things, which hopefully will, in the long run, address that overrepresentation.
Okay, so Mary, actually, before I let you go, there is another question regarding the Black youth in foster care, and particularly the needs to address those with special needs, since they're at a greater disadvantage of transitioning into adult services later on. Is there anything being done in that regard?
Okay, just to clarify, is that kids who are already in foster care, you're saying? Or
admittedly, I'm not sure. It's regarding the high number of Black youth in foster care. So I would say probably at the moment.
Okay, so I know there are efforts of staff at DCF to really look at the educational needs of kids, and I would hope that some of that will translate into addressing the issues of kids with disabilities. I know Nina Peckman at ACNJ, who's our attorney who handles education issues, works with a lot of the law guardians and caseworkers to try to make sure kids' needs are being met, their educational needs are being met. In terms of transition, there's been some new initiatives again in the department to try to work with the older youth who are aging out to make sure they have that connection to a permanent, a caring adult who will help them transition. I don't know, Catherine, am I getting at that? Or in the beginning, I also think a lot of the caseworkers are trying to work with schools, which is where some of these referrals would come from, to really make sure that we're talking about abuse or neglect and not talking about a family that just has some needs. And if the family has some needs, that we try to address those needs without bringing that family into the system.
Great, thank you so much. So, Alana, I do have another question. So regarding the importance, you reported on the importance of mental health. Is there any data that specifically gets at child-informed mental health?
Unfortunately, no. If we're talking about the household pulse survey, that data is only available based on adult respondents. So it's asking for that adult who responded. In some cases, the questions are for you, the respondent, or anyone living in your household. That was the case for the employment data. But for the mental health, I believe it's specific to the respondent. And then in terms of our other reports, there isn't anything that gets to mental health directly. It's certainly an area where we could use more data collection. But again, it's a sensitive topic. And so there's complete understanding and why that data is a bit more difficult to access.
Okay. And this one's actually more of a logistical question. The PowerPoint can be available for downloaded later, so I wanted to inform of that, as well as remind everybody, please make sure that you're able to use the Q&A function to ask any questions. So in regarding the household financial security, what's the data reporting on household income and parental education, if any, or professional certification? So that way, when we see the economy kind of emerging and changing, we see how the educational levels also impact it.
So in terms of our county data, I hadn't pulled any information about household median income by education level or poverty rates by education level. That data does exist. I just haven't pulled it for Kids Count. For the household pulse survey, I know that you can also break down the data by education level of the respondent. If I'm remembering correctly, I don't think that is represented on the data center in quite that way, unfortunately. So it's something I can look into, but I know with the household pulse survey, when we start to drill down into smaller and smaller categories, it does get the samples get very small and it does get a little challenging.
Is there a place for people to pull the household pulse survey themselves as well?
They can. It is a little tricky. You can go to if you go to the Census Bureau's website and go to experimental data products, you can navigate to the household pulse survey data. You can download the actual data tables week by week. The microdata files are also available and are there for analysis, but that is a bit more technical if you don't have that capability.
Okay, now you also mentioned a couple, admittedly kind of alarming data regarding the household pulse survey in terms of food insecurities and whatnot. I want to see if there's any action from the state in response to those.
So in terms of state action, I know that school districts around food insecurity have been distributing school meals at sort of school meal distribution sites across the state. It isn't necessarily quite the same as receiving a meal in school, right? There's a much easier sort of access, getting school lunch when you're in school versus going to a location to pick up lunch. There's also the pandemic EBT program that was made available for families to purchase food for their children who would typically be receiving a free or reduced price meal at school. There have been some implementation challenges with that funding and with that specific program, but it is something that has been rolled out since the start of the pandemic and has allowed a number of families to purchase food for their children. And I would encourage folks to reach out to some of our partners at Hunger Free New Jersey, who have done a lot of really wonderful reporting. Also FRAC, the Food Resource Action Center, I hope I got that acronym right. They also have some really great resources on food security.
Thank you so much for that. And let's see, this is an interesting one. So in early 2019, the bipartisan National Academies of Science panel released a plan to cut child poverty in half over 10 years. So that's 2019. We're in 2020, almost 2021. Has our congressional delegation done anything to put that plan to action at all?
So I am not aware of this. I don't know if this is a question for Seal, if you have any familiarity with this. Hi, Seal.
Hi, good morning. Great question. And my sense is I'm certainly familiar with the report. I'm not certain of any specific action on it, but I do know that New Jersey has I think a very sensitive and delegation that is focused on the needs of children and families. We've done a lot of work with our delegation this year on the federal stimulus package, particularly around childcare issues. And I think we're very lucky to have them representing us in Washington. I know Senator Booker has been a key lead on these issues. My sense is that whatever plans were in place were put on hold due to the emergency of the pandemic and the necessity for action in Washington to help states with the pandemic. But it is certainly something that I would think our delegation would be very interested in.
All right, I actually see it. While I have you on, I do have another question that is regarding federal policies. Is there any concern about any federal policies that were enacted by the Trump administration that might actually influence New Jersey, especially during the pandemic, from an ACNJ standpoint?
I'm sorry, are there any policies that were enacted that would impact on New Jersey?
The person specifically calls out the immigration policies, for example, the
public charge.
Administration public charge.
So I think everyone had concern about the public charge, which I think would have impacted very negatively on immigrant families. ACNJ opposed that. We were part of a national advocacy movement to oppose public charge that was not completely successful. I think some aspects of that have been changed, but I think we need to look forward on the new administration coming into Washington to see if that is going to continue to be implemented as intended.
Okay, so it does look like we are winding down on our questions. So is there any parting words that anybody has? So Mary, if you want to hop on as well.
So I will say thank you to everyone for attending today. I know it's not quite as exciting as a morning at the Adelphia and a nice breakfast and some coffee, or for anyone who's ever attended an in-person Kids Count event. I'm looking forward to beginning those again, but thank you all for coming today. I really enjoyed sharing this information. Check out our website, and if you have any questions, please do not hesitate to reach out.
Mhm.
I would just second Alana's closing. Thank you all for joining us today. And I just want to extend my congratulations to Alana for her Kids Count work, and to the ACNJ communications team, who has kept us all advocating since the pandemic started 10 months ago. Again, we started out by talking about what an unusual time it was to report on data. I do think that data is valuable, and it's not too soon to start thinking about the impact of the pandemic and what are the implications for our policies as well as the upcoming state budget. And again, I would urge everyone to continue to focus on our federal advocacy. As I said in response to an earlier question, we have a very strong congressional delegation who I think is very sensitive to the issues here in New Jersey, but they need to continue to hear from you about what's important. We saw that when we advocated around childcare funding, and that while we found a very welcoming and sensitive response from our delegation, the understanding of the details was not there. That's why you're all needed, to tell your stories, to step up, to advocate. And as usual, we hope this data will help you do that. So thank you for joining us, but more importantly, thank you for your advocacy during this incredibly challenging time.
All I'll add is that it's really important, as Seal said, to hear from all of you. If you have other questions, or if we didn't fully give you the information you needed, all of our email addresses are on our website. So please reach out, because like many of you, we are all working remotely, but we want to be accessible.
All right. And that is the conclusion of our program. We are going to give you 3 minutes back. Again, we encourage you to go to acnj.org in order to view the information and to ask if you have any questions. Again, Alana did offer her email out, so I'm going to repeat it. It is avega@acnj.org. Feel free to get in touch, and we hope you have a wonderful rest of the day. Thank you.
Thanks.